Stage 3 kidney failure now, so my kidneys are failing. I've got diabetic retinopathy. I am disabled. I am visually impaired. Diabetes relief for me is turning back the clock. They've done something no other hospital or doctor has been able to do, and that's regulate me.
Well, approximately 29 million people suffer with diabetes in the U.S., but our next guest has a new treatment to actually get rid of the diabetes, or put it aside, if you will, right? And in some cases, it reverses the damage caused by this life-threatening disease. Here to explain how it works, please welcome Dr. Marcin Vaclaw with Diabetes Relief and patient Joshua Guzman. Good morning. Dr. Vaclaw, let's first start with what diabetes does in the body, because I think a lot of people misunderstand what it is.
Sure.
But it is the cause of a lot of damage.
Absolutely, yeah. The biggest problem with diabetics is essentially their pancreas metabolically shuts down. And so what Diabetes Relief is trying to do is to get the liver to function independent of a failing pancreas.
Yeah.
And so what that does is it essentially boosts the patient's metabolism and gets their bodies working as if their pancreas...
Yeah. The pancreas and liver start talking to each other again, right?
Essentially, we get that liver functioning independent of a bad pancreas.
Yeah, yeah. And the thing is, when you have diabetes, it is the leading cause of blindness, leading cause of amputations, leading cause of renal failure, leading cause of heart disease. So that's the umbrella over so many different things. And I think sometimes people think, well, I just have heart disease. Well, it's not just heart disease. If it's the diabetes causing it.
Exactly. And really, it can even go back further than that, where their metabolic process to their body just kind of shuts down,
yeah.
which then causes the diabetes and causes all these other side effects and problems that
yeah.
you're talking about.
And Joshua, basically what it is like a slow death, isn't it?
Yes.
So when you were first diagnosed with type 2 diabetes, what were you noticing that your body wasn't acting right?
Well, it's type 1 diabetes.
Okay, you're type 1. Okay, so here's the thing. Type 2, we thought people can kind of control by losing weight in some cases, but type 1's the one that is completely different. That's not the issue there.
Correct. Yeah, in both cases, what's going on is the pancreas isn't working the way that it should.
Right. Okay. So yeah, it's a little bit harder in the past to basically try to manage type 1. So what types of things, like for your body, were you noticing the symptoms, and were they getting worse as you got older?
Definitely got worse as I got older. First it was the constant urination at first, and then extreme weight loss, fatigue. When I was diagnosed at 17 years old in high school, I lost 25 pounds in less than 2 weeks.
Wow.
It was pretty bad.
Yeah.
This was in '92.
In terms of treatment, basically what they were doing is just kind of maintaining your body, right? As opposed to improving things.
They weren't doing enough, that's for sure. I kept getting worse.
Yeah. And the reason why they weren't doing enough is that conventional medicine just doesn't do that, right? It's basically up the insulin,
Right.
but it doesn't really put the diabetes at bay.
Yeah, diabetes has essentially always been kind of just a slow downward progression over time. And naturally, part of aging is sort of a slow downward progression with time. But managing diabetes has just tried to kind of maintain a diabetic patient at a certain level and slow down that progression. And what we're finding with Diabetes Relief is that we can actually give them their life back. We can actually help all of those negative side effects from diabetes not affect their daily life.
Yeah, and the crazy thing about that is not only do you do that, but it can also reverse some of the damage. You have people who are going blind who can now see.
Exactly.
You have one gentleman... There's one gentleman, I remember, who was coming into the center in a wheelchair. Then he graduated to a walker, and now he's walking in.
Exactly. Yeah. And Josh is a perfect example of someone that has nerve pain, nerve damage in their feet, as their
which oftentimes people get it amputated.
Absolutely.
And because you can't heal, they amputate more and more.
Exactly. So, Josh, for example, is given an example of being able to walk into the ocean, right? You're saying you can walk on the beach.
Right. I couldn't feel the temperature of the water at first until it got up to my knees. So when my wife was like, "Oh, it's cold," I'm like, "Oh, no, it isn't."
Yeah.
Now, after the treatment, I can feel the temperature of the water right when I get in.
When you first heard about this treatment, did you think it was too good to be true?
I went immediately. A friend told me about it.
Yeah.
He used to be with Diabetes Relief, and he said I was a perfect candidate because he knew over the years of everything that was going wrong, the blood pressure and my loss of vision and so on and so forth. And when I got there, it did seem Too good to be true.
Magic,
And
right?
I believe in this, in what they're doing. Otherwise, I wouldn't be here.
Yeah, well, the results tell you. That's the whole thing.
Correct.
The results tell
Absolutely.
you. All right. You have the metabolic pills that help to do things too, so that kind of work with the body.
Yeah, exactly. So the treatment that they get at Diabetes Relief is to help maintain their body's metabolism. There are other things that are administered throughout this treatment to kind of help them maintain it. And this has been so successful that Diabetes Relief is taking more and more patients in. They have
People
an
are coming
office.
from around the country.
Oh, absolutely. We have patients from as far out as Utah. Diabetes Relief has since had to expand, which is how I became involved. My office is up in the Woodlands, and Diabetes Relief now finally has a satellite location for all of the patients that live on the north side of town, and we're trying to find more and more. You can see here some pictures of the lovely
It's a really
suite
pretty
that they
place.
have. It is.
Yeah.
It's a very beautiful place, great
Being
setting.
a podiatrist, a lot of people will come in just to get their toes clipped, because when you're diabetic, if you have a little bitty cut, that little bitty cut can mean an amputation if it's not done correctly.
Absolutely, and that's something very dangerous that we find in diabetic patients. And so we, as podiatrists, we try and help them with that. We try and take care of them with that. Our office is a little unique in the sense that we actually travel to patients' homes. Some of these geriatric patients, they can't get out. We make that visit because, as Josh knows, if you can't feel your feet, you could be trimming your own toenail and cut the skin. It could get infected and lead down that road.
Yeah. How often does somebody need to go in if they're getting treatment with Diabetes Relief?
Everybody is different. The initial consult, they kind of determine that depending on what you need. Some people need to come in a little more frequently until they get their metabolism regulated.
Right.
The goal is to minimize that and
Right.
essentially get your body to kind of learn how it needs to be temporarily.
Help it to function on its own.
Right.
Yeah. All right. So, Joshua, your life today?
Energy's through the roof. I no longer get winded walking the block.
Because you can walk the block,
Because
too.
I can walk the block, and I'm going to be walking.
Basically, what happened is that you got your life back and you just added years to your life.
Correct.
All right. You can get a free bottle of Metabolism Enhancer when you have a consultation with Diabetes Relief in December. You can call them now at 281-600-5000. 281-600-5000. Just mention Great Day Houston when you call. And for more information, log on to diabetesrelief.com. I've met about 4 or 5 people who have actually been to Diabetes Relief, and it's crazy. Like the neuropathy's gone, the eyesight coming back, no need for dialysis anymore. It's pretty much a miracle. So thank you very much.